I've had loads of messages recently asking me to explain how to use a spacer. Now these only work with this type of inhaler. This is a pressurized metered dose inhaler. This is the only inhaler that can fit into this. It does not work with turbohalers like this one, and it doesn't work with Easyhalers or Nexthalers or any other type of inhaler. It needs to be an inhaler that looks like this. The first thing you want to do is just make sure that there are enough doses left in here, because if there aren't enough doses, there's no point using the inhaler. The second is you want to check the expiry date. So this one expires in August 2025. Put that back in. Then we remove the cap. We should give it a really good shake, and then we put it into the back end of the spacer. Now when you do this, it might be a bit tight, but that's important because we will need to create a tight seal around that mouthpiece. The next stage is we remove this cap. When we use the spacer, it can be a bit of a pain in the butt sometimes, because when we're taking those breaths in and out, you have to breathe slowly, and it's been designed in that way so that as much of the medicine as possible is going into your lungs. If you're breathing too hard, then that medication will get stuck on your teeth and your tongue, at the back of your throat, and it won't be going down into your lungs. And if you breathe out too quickly, then you will also just be expelling all that medication as soon as it's come into your lungs. So we want to be breathing in, and the reason that you breathe out through the mouthpiece is because there's a filter and it really slows down your exhalation. So then the next step will be to spray the inhaler into the chamber. We then create a tight seal with our lips and mouth around the mouthpiece when we put it in our mouth, and then we just breathe in and out normally through our mouths 6 times. Some people recommend doing it up to 10 times. Once you've done that, you would give the whole thing a shake, or take the inhaler out, give it a shake, put it back in, and then do the same thing again if you're using 2 puffs. So I will give you a demonstration of one breath. So we spray, we keep a tight seal. That's the air coming out slowly from my mouth through this filter. And it's just ensuring that that medication is staying in my lungs as long as possible. And then you want to breathe in and out through your mouth at least 5 or 6 times. If you're breathing in too hard, this will start whistling, and you need to really slow down your inspiratory rate. So here's an example of what that whistle sounds like. We want to avoid that because, as I said earlier, that just means that the medication is just hitting the back of your throat. It's not necessarily going into your lungs. We want to try and maximize the amount of medication that's going into your lungs. So then once you've done your 2 puffs, sometimes you may need to do more than that. Take your inhaler out, pop your mouthpiece back on, put this somewhere safe. Then you want to clean the mouthpiece, and then you can rinse it out around once a week, usually with warm water, and then let it air dry. And that is how you use a spacer. If you have any questions, let me know in the comments or send me a DM. Send this to someone who has asthma, someone who uses inhalers and spacers, because they might find it helpful and it might save a life.